Let Century Management Solutions get you to your next medical appointment. They specialize in non-emergency medical transportation, connecting patients to care, safety, reliability, and on time. Their advanced technology platform seamlessly coordinates patients, healthcare providers, insurers, and transportation partners all in one powerful network. With over 200 trusted transportation providers, they deliver scalable solutions backed by real-time tracking and complete transparency. Go to SENTRYMS.com.
Listen, all you New Yorkers. Excuse me, taxi.
Okay, man, we're looking around.
This is the 77 WABC minicast.
With us today is Dr. Mehmet Oz, and there's so many things to report from the President's Health on. Dr. Oz, where do you want to start today?
Well, let's start with the breaking news, because I was just in Ohio with the acting Attorney General, Todd Blanche, Kash Patel, FBI director, and we had a big announcement in the Buckeye State about a fraud initiative. Took down a lot of bad people. State Medicaid office there stopped 49 home health care providers from defrauding the public. We've created a war room that will allow an all-of-government approach. And what that means is we get to have the FBI and the Department of Justice and the Office of Inspector General and the Treasury all working with us at Medicare Medicaid. So we can actually say, hey, listen, there's too much money going out to autism care here. It's 5 times more than it was 2 years ago. Something's wrong. And then they start looking after the bad guys, and we can then stop paying the money out, which is why we are so focused on this, because when the money leaves the building, it's going to international syndicated corrupt groups. It's going overseas to other countries. In Ohio, they have a large, second biggest Somalian population behind Minnesota. They have folks from Bhutan there who met these massive fraud schemes. These guys come here, they buy beautiful luxury cars, yachts. They're toasting champagne on private jets that they buy. They send the money back to Bhutan, and no one seems to be watching the till. And so, because the last administration basically advertised, go ahead and steal if you want, we're not coming after you, these guys did just that. They followed orders, and we're coming in there and saying, not only is there a new sheriff in town, we don't want you walking away, we want you running, because we're coming after you.
Dr. Oz, shouldn't maybe the president put somebody in between the normal course of business with the money going out to somebody that's a Doge type person to say, I'm going to double check and make sure 5 minutes before anybody sends a check out?
So the way that Medicare works, which is for seniors, we have that. We've stopped $40 billion leaving the building last year. But Medicaid is run by the states. So here in New York State, which is a massive Medicaid budget, the largest Medicaid budget.
The new budget is $125 billion, I understand.
Yeah, it's incomprehensibly large. And the bigger concern, of course, is that you're not necessarily getting good quality care for that invested money. It's being stolen, a lot of it. And so you got to figure out who the good players are, who the bad players. The states have seemingly taken their eye off the ball. They don't seem to care so much about that. They don't think they're getting graded on whether or not tax dollars are being used correctly. They're getting graded on making sure that there's plenty of services out there. What ends up happening is people who aren't really capable pretend that they're doing the right thing. And in many of these states, you've now taken things like personal care services, which is, doing things for your patients that your families would do for them normally. So carrying the groceries, driving them around, picking up stuff, errands. This is the kind of stuff we're not paying for. But if you're a perfectly healthy individual and you want to give your kid a job, this is a good way of doing it. We now have the number one job in the entire state is personal care services. In fact, John, it's twice more common than the next most common job. So it's a shocking reality. You got twice as many people in personal care service than fast food restaurants. And these numbers get bigger and bigger.
It's far beyond that. I understand Florida, with 24 million people, it's only 33 billion. Now, New York, with only 19.5 million people, is 125 billion. How can that be possible?
You have an unholy alliance between groups that should be competing over tax dollars. Instead, they say, you know what, let's get in the same team. Let's all work together. We're all going to go to Albany and get these guys, these suckers, to give us the money that we want. And then the people in Albany say, you know what, not such a bad problem because we're not paying for it a lot anyway. A lot of it's coming from Washington. So this is a great game. We're going to pretend like we care about people, pretend like we're paying this extra money in. We're going to collect the money from other states because it's coming from the federal tax till. And then you have other states who are beginning to learn from New York. They're starting to do this. We have kids with autism that are getting charged close to $1 million for autism care a year. I mean, I'm a heart transplant surgeon, as you know. I can do a heart transplant for a couple $100,000. I mean, you're talking about you got to spend that kind of money for every single kid with autism. Obviously, it's fraudulent. No one's watching because nobody wants to be called the bad guy. Everyone says, "Oh, you're cutting access to care." The truth is, you're making care more available because your biggest allies are the legitimate providers. And if they don't run a real business and take care of people and get paid appropriately, they leave the business. So if you're a regular stand-up home health care person trying to do the right thing, and all these fraudsters are stealing people around you, they drive you out of business because you're trying to do your job. You're actually paying people to help. They're not. They're pretending to help. They're not even providing the service.
Rita?
Yeah, Dr. Oz, one other thing, too. By the way, you have been so busy this week. I can't believe I was watching your press conference earlier from Ohio. And then the day before, you had this huge announcement about Trump RX. This is big news, too. Can you share it with us?
Of course. Well, I was blessed while Caroline is out on maternity leave, Kat Levitt, who are our press secretary. So they're picking different members of the administration to guest host the press briefing. So we had a big announcement on Trump RX. So they had me do that task, which I was.
You did a great job, by the way. I was watching. You did a great job.
It felt like my show. It felt like I was taking questions from guests at the audience. Right. But the issue about Trump RX is really critical, and you guys have been following this, so I want to give you credit for it. The average American knows that there's a reasonable chance when they go to a drugstore, they will not afford their medications. That's happening to almost a third of Americans now. But the reason for that is we're paying 3 times more than people in other countries for the exact same drugs, even if they're made in this country. And so the president said, no mas, we're not going to do that. We want you to go negotiate with these drug company manufacturers. Do not price fix. Do not drive innovation away. Just tell them whatever they charge overseas, they got to charge here. So either raise your prices overseas or lower them here, or probably both. Turns out they do both. The industry's happy with it. We signed all 17 of the biggest companies up, and we decided to put all those really good prices for medications on TrumpRx.gov. Now, this is a website that is free for you to use. We added 160 more medications to it this week, which is why we did the press event. And the major message is 4 out of 5 times you buy a medication in a drugstore, we will be able to give you a price for that on TrumpRx.gov. So you need to check the site before you make a purchase. In fact, the big drugstore chains like CVS and Walgreens, they're starting to put computers in their pharmacies, so you can just check there before you make a final purchase to ensure you don't have a better price. If you have a better price on TrumpRx.gov, just show the coupon to the pharmacist, you get the price.
Wow, good for you. Well, this is amazing. Good for you. You did a great job, by the way. I love Caroline, but you were great.
Yeah. Anything else you want to tell the American people while we're still on?
I'm very proud of the fact that we are putting work requirements into place. John, you worked your whole life. People at the different venues that you're a proprietor of have to work their tails off. Most of us do that. It brings joy to our lives. But if you're able-bodied and on Medicaid, like in New York, you don't have to work. And that's changed now with the Working Families Tax Code legislation. If you're getting free government insurance, you actually need to go to work 20 hours a week, and we will help you get a job if you can't work those hours. Or you can get volunteering credits, or you can go get an education. Just do something. Here's the number I'm going to leave you with. The average person who's able-bodied getting free health insurance through Medicaid watches 6.1 hours of television or just hangs out every day. That's not fun. You have agency. You have a purpose in this life. Go out and earn it. Go out and do it.
Dr. Mehmet Oz, thank you so much for coming on this Thursday evening, and we'll catch up with you again real soon. Thank you for everything you do.
God bless both of you. Take care.
Thank you. Thank you, Dr. Oz.